Hey, do you have hypermobility, possibly EDS? So from this book, I did a video a couple of weeks ago on how I'm like super bendy and I can bend all my fingers and all of these joints bend backwards and I've got stretchy skin, and someone in the comments was like, "Oh, you need a diagnosis." Right, okay, so here from this book, we will find the answer. So on page 394, we have the diagnostic criteria for hypermobile ehlers danlos syndrome. Okay, so right at the very beginning, we have generalized joint hypermobility. This is the Baton test. Now, if you need to score more than 6 if you are prepubescent or an adolescent, so basically a teenager. You need to score 5 or more if you're a man or woman up to the age of 50, and you need to score 4 or more in men and women over the age of 50. Because obviously things generally tighten up a little bit as you age. So, according to this test, 1, 2, 3, 4, there's only 5 pictures on the on the thing, so that's clearly not all of the tests. So if you know what the Baton score is, or the Baton test is, go look that up. There's probably 9 things to look at. Go check them out. And if, depending on your age category, if you score higher than that number, then congratulations, you are hypermobile at the very least. Okay. It also includes some questions underneath. You can't quite read them. It's a bit of a blurry picture. Can you now, or could you ever place your hands flat on the floor without bending your knees? Yes, I can. Cool. Can you now bend your thumb to touch your forearm? Yes, I still can. As a child, did you amuse your friends by contorting your body into strange shapes, or could you do the splits? I've never been able to do the splits, but I've always been very, very bendy. Look, watch this one. This one's fun. I can clap with one hand. I don't know if that's got anything to do with hypermobility, but I've got bendy fingers. Okay, as a teenager or a child, did your shoulder or kneecap dislocate on more than one occasion? Yes, multiple times. Do you consider yourself double jointed? Yes, that's what I always called it because I didn't know it was called hypermobility. Next section, criterion 2. You need 2 or more of the following features in A, B, or C. Okay, so it's not an and. Okay, unusual soft or velvety skin. I'm so soft. Okay, mild skin hyperextensibility. I am stretchy. Okay, unexplained striae, basically stretch marks is the third one. I don't have stretch marks, and it also says without historic excessive weight gain and weight loss. Okay, so I don't really have stretch marks. I do have a little bit kind of in my armpit. I always put that down to lifting some weights when I was about 14, 15. I don't think they were there before. And anyway, bilateral piezogenic papules of the heel. I don't have that one. Okay, so that's when you press on the pad of the heel and you get these kind of weird lumpy looking bits. I did have that in the past. Don't have it now. Recurrent or multiple abdominal hernias. Okay, don't know if you can see that scar there. Okay, had a hernia operation in 2007 or 8, maybe 9, and it's back. Okay, it didn't really work in the first place. So yes, tick. Okay, now I don't understand this one. I'd need to look up some of the words. Atrophic scarring involving at least 2 sites without the formation of truly capricious and or hemosideric scars as seen in classical EDS. Honestly, I don't know the meaning of those words. So I couldn't say yes or no. Probably no, I think. Pelvic floor, rectal and or uterine prolapse in children. No, didn't have that. Men or nulliparous women without a history of morbid obesity or other known predisposing medical condition. No. Dental crowding and or high or narrow plate. A little bit of crowding, but not significant. I've still got 32 teeth. So unlikely on that one. Arachnodactyl, as defined in one of the more following. Positive wrist sign. Now, again, I'd need to check up the meanings on those, but if you know them, fine, check it out. Okay, arm span to height ratio. Yes, I am 6'1". My arm span is about 6'3". So, yes, tick. Mitral valve prolapse, mild or greater, based on strict echocardiographic criteria. Now, unless you've had an ECG, you won't necessarily know that one. I had an ECG before I joined the army because there were concerns about my heart and joining the army. Turned out it was fine, but there's probably something going on there. Aortic root dilation with Z-score greater than 2. Okay, I don't know what the meaning of that is. So feature B. Okay, so I've got many ticks in those. Okay, so I've got I don't know, 6 or 7 out of 12 on that. I didn't count it. Okay. Feature B, positive family history, 1 or more first-degree relatives independently meeting the criteria for hypermobile Ehlers-Danlos syndrome. Looking at my mum particularly, also my brother and my sister, it's quite likely, but none of us are diagnosed. So, feature C, musculoskeletal pain in 2 or more limbs recurring daily for at least 3 months. I can tell you I have had that since I was 9 years old. So, 30 years I've had musculoskeletal pain in 2 or more limbs daily. Cool. Chronic widespread pain for 3 months. We're talking kind of fibromyalgia type stuff here. I don't know. That's a no for me. Recurrent joint dislocations or frank joint instability in the absence of trauma. Yes, have that all the time. Cool. Right, here's where it falls down for me completely. I think I'm a no in all of these boxes. Criterion 3, and you need all 3 of these to have that diagnosis. Absence of unusual skin fragility, which should prompt consideration of other types of EDS. So it's a broad spectrum under EDS. Exclusion of other heritable and acquired connective tissue disorders, including autoimmune rheumatologic conditions in patients with an acquired CTD, lupus, rheumatoid arthritis, etc. Additional diagnosis of HEADS requires meeting both features A and B of criterion 2, feature C of criterion 2. Cannot be counted toward a diagnosis of HEADS in this situation. So I probably don't have hypermobile Ehlers-Danlos syndrome, but I certainly have a lot of base markers of hypermobility. I might have something else instead. Hooray! Okay. Exclusion of alternative diagnosis that may also include joint hypermobility by means of hypertonia and or connective tissue laxity. Again, I'd need to check the meanings on some of those words. Alternative diagnoses and diagnostic categories include, but are not limited to, neuromuscular disorders, e.g. Bethlem myopathy, other hereditary disorders of the connective tissue, i.e. other types of EDS, Loeys-Dietz syndrome, Marfan syndrome, and skeletal dysplasias, osteogenesis imperfecta. Exclusion of these considerations may be based upon history, physical examination, and or molecular genetic testing as indicated. Now, look, living in the UK, getting the NHS to do this, I'm not dying, right? So the NHS, this is a low priority, okay? I'm generally fine. And I don't know if the other ones are serious or not, but here we go. Right, next bit. Didn't take a picture, but I'll briefly cover it. Okay, so this is treatment. So may consider it depending on basically pain levels, okay, and fatigue. We've got stress management techniques, splinting or bracing recommendations, cognitive behavioural strategies, and referral to other providers as appropriate. Okay, and then it goes on to explain you can tape, you can put, knee braces, elbow braces, wrist supports, etc., etc. Okay, I don't like any of that stuff, but it might be what you need to do. The main thing really is strengthening. Okay, it's a strengthening program. It's exercise. Okay? It's using bands, not necessarily weights, not necessarily heavy weights, but banded exercise, potentially Pilates, something like that. You don't want to go into a point of too much stretch. Okay, you don't want to go into a point of too much stretch. So yoga might be off the cards, but depending on the form of yoga you do, if it's more like handstands, headstands, and you're holding yourself in strength positions, you might need to progress to that depending on what kind of severity you've got in the EDS or hypermobility range of things. But stretching on its own is not necessarily the best idea because your connective tissues are already lax. Okay? It's stuff like plank, okay, but with a slightly bent arm, okay, rather than fully locking out your elbows because they're probably a bit unstable anyway. Okay, it's stuff like core work, yeah, boring as hell, but that's the kind of thing. So it's going to be squat holds rather than back squats with 50 kilos on your back. Okay, anyway, I've run out of time. Hope you enjoyed that. Have a good day.